If you've ever discovered a lump or bump in your vaginal or vulvar area and told yourself, "It's probably nothing," this video is for you. Not all lumps are dangerous, but some are. And ignoring them could mean missing the early warning signs of something serious. In this video, we're diving into 10 medical reasons you should never ignore vaginal or vulvar lumps, from common cysts to signs of infection, STIs, skin conditions, and even cancer. By the end, you'll know what to watch out for, when to seek medical help, and how to protect your health with confidence and awareness. Reason number 1. It could be a Bartholin's cyst, and it can become infected. Bartholin's glands are located on either side of your vaginal opening. They produce mucus that helps lubricate the area. Sometimes the duct of one of these glands gets blocked and fluid builds up, forming a Bartholin's cyst. Most Bartholin's cysts are painless and may go unnoticed. But if bacteria get in, it can lead to a painful Bartholin's abscess, causing redness, swelling, and difficulty walking or sitting. Why this matters? Untreated abscesses may need to be surgically drained and can recur if not properly managed. Early treatment is always better. Reason number 2. It might be a sign of a sexually transmitted infection, STI. Some STIs, including herpes, syphilis, and human papillomavirus, HPV, can cause lumps or bumps in the vaginal or vulvar area. Herpes presents as painful blisters or sores. HPV can cause soft, flesh-colored genital warts. Syphilis may start as a single painless sore before progressing to more serious stages. Why this matters? Many STIs are treatable, but leaving them unaddressed can cause long-term health issues like infertility, nerve damage, or increased HIV risk. Reason number 3. It could be an allergic reaction or skin irritation. Skin in the vulvar area is delicate and highly sensitive. Common irritants include fragranced soaps or bubble baths, laundry detergents, certain fabrics, latex and condoms, tight-fitting underwear. This can cause swelling or inflamed bumps known as contact dermatitis. Why this matters? Repeated irritation weakens the skin barrier and may make you more vulnerable to infections. Identifying and avoiding the trigger is key. Reason number 4. A lump could be a sign of vulvar cancer. Although rare, vulvar cancer is most treatable when caught early. It often presents as a persistent lump, a sore that doesn't heal, changes in skin color or thickness, unexplained itching or pain. Most vulvar cancers develop slowly, beginning as precancerous skin changes like vulvar intraepithelial neoplasia (VIN). Why this matters? Vulvar cancer can be life-threatening if it spreads. Early detection through a simple biopsy can save your life. Reason number 5. Hormonal fluctuations can cause temporary swelling, but not always. Hormonal changes during menstruation, pregnancy, perimenopause can cause the vulva to swell or feel lumpy due to increased blood flow or fluid retention. However, if the swelling persists beyond your cycle, becomes painful, or changes in texture or size, it could indicate another issue like a cyst, fibroma, or abscess. Why this matters? Not every change is hormone-related. If it lasts more than a few days, get it checked. Reason number 6. Ingrown hairs can become infected and mimic serious problems. After shaving or waxing, you may develop small red bumps, which are usually ingrown hairs, harmless but annoying. But if an ingrown hair becomes infected, it can swell into a painful lump filled with pus. In rare cases, this may lead to a follicular abscess, requiring antibiotics or minor surgery. Why this matters? Don't try to pop or pick at it. That can worsen the infection. If it's not healing, see your doctor. Reason number 7. It might be lichen sclerosus, a chronic skin condition with cancer risk. Lichen sclerosus is a long-term inflammatory skin condition that causes white patchy skin, thin or wrinkled vulvar tissue, itching, burning, and sometimes scarring, lumps or thickened skin in chronic cases. It's more common after menopause but can occur at any age. Why this matters? Lichen sclerosus increases the risk of vulvar cancer if left untreated. It's managed with prescription steroid creams. Early diagnosis is key. Reason number 8. Lumps can cause pain during sex. Don't ignore it. A lump or swelling that interferes with intimacy can be caused by vestibulitis, vulvodynia, fibromas. Pain during sex, dyspareunia, is not normal and is often dismissed. But it's your body's way of signaling that something is wrong. Why this matters? Avoiding intimacy because of pain can affect your emotional and relationship health. Treating the underlying issue can restore comfort and confidence. Reason number 9. It can affect urination hygiene or even how you walk. Depending on where the lump is, it might obstruct the urethra, cause discomfort when urinating, rub against your underwear, lead to odor or discharge if infected. Pain or pressure near the urethra could also indicate a Skene's gland cyst, which sometimes needs to be drained. Why this matters? Difficulty urinating or maintaining hygiene could indicate a growing or infected mass. Ignoring it could lead to more severe complications. Reason number 10. Your health is too important to leave to chance. You know your body better than anyone. Something feels off. A new lump, a growing bump, skin changes, or pain. You owe it to yourself to seek answers. Doctors are trained to examine these things professionally and confidentially. You don't need to feel embarrassed. The earlier you act, the more options you have for treatment and peace of mind. Why this matters? Vaginal and vulvar health is a vital part of your overall well-being. Don't delay care due to fear or shame. Now you know the 10 important reasons you should never ignore a vaginal or vulvar lump. If you've ever had a health scare or learned something from a routine checkup, share it in the comments. It could help someone else feel less alone. Don't forget to like this video, subscribe for more health education, and turn on notifications so you don't miss the next one. Thanks for watching. Take care of yourself, and never be afraid to speak up for your health.